To start us off, we have a conversation that probably comes off the week we are in. It's actually the National Deaf Awareness Week, and on Monday we were able to commemorate the International Day of Sign Languages. Now, this brings to the fore the reality of living with people with disabilities within our communities, and to understand the strides they have made in as far as getting their rights catered to, and of course the challenges they live with. With me in studio, I have Peter Mushiri. He is the board chair of the National Council of People with Disabilities. Thank you for making time.
Thank you.
All right. And I think it's important we start off with the fact that this is actually a very important week for those living with disabilities. And tell us, what is the importance of Monday, International Day of Sign Languages?
Okay. Good morning, everyone. Monday we celebrated the International Sign Language Day. And this was the first time this International Day was celebrated in Kenya. Why am I saying this? Because internationally it has been, people have been celebrating. But as the National Council for Persons with Disability, we felt that we need to host this International Day here in our own country. And now, I would like even to ask the media, because we only see sign language in the news. And we don't see sign languages interpreter during other programs. And as a country, we know very well that sign language is the third official language in our country. So we wonder what is wrong in between. Okay,
I guess at this point it will be prudent that we actually clarify that according to the Broadcast Programming Code that was actually put into place in 2010, was it? No, in 2016 for the first time by the Communications Authority. It actually said all media houses are required to ensure they use 100% signing during news, events of national importance, as well as all emergency announcements, which in our case is called breaking news. So I guess that's why we don't have a sign language interpreter in such a show. But what would be your expectation?
Yeah, my expectation is that also media have other programs, which also we have a population of 2.5 deaf people in our country. That is a huge number of people, and also customers who would like to see your programs interpreted, and they understand what is going on, current affairs, and also the program you are running. So we as the National Council, we are going to write to the Communication Authority of Kenya just to understand why, because that is a discrimination of highest order. Because these people need to understand what is going on, which are the programs which are run by our media houses. And sometimes these people felt they are left out. And specifically, that is what we were discussing on Monday, just to create awareness in our country that sign language and deaf people, they are part of this country.
Okay, so definitely a lot more needs to be done, but at least we have made strides in the right direction. So those kind of strides, how far have they gone along in making things easier for those living with hearing impairment?
Yeah, you see, one of the most vulnerable group are the deaf people, let me tell you, because their rights are violated each and every day. Look, when somebody who is deaf and he happened to visit a doctor, and some of the matters you are going to discuss with the doctor are private, but you need an interpreter there now. That's no more now, it's not a secret again. So even in our hospitals, media houses, everywhere, we need to train sign language. And as a council, this year alone, for the last 3 years, we have trained 958 sign language interpreters. This year alone, we have allocated 350. And we take this, we train people from government ministries and even private sector, just to make sure that we try to bring a massive awareness of deaf people and sign language
Okay, you bring to the fore something very important, especially the privacy of a patient with the doctor. You'd like to just have that conversation with the doctor without somebody interpreting it. So are you saying you have been training people like doctors and nurses so that they are able to understand the patients firsthand?
Yeah, normally what we do, we request Ministry of Health and other government department and ministries just to give us around 2, because you see now, as per financial year, this financial year we have 350. So even you, media houses, we shall be requesting you to give us some of your staffs so that they can be trained as sign language. And also, the management, be ready also to support some other officers to be trained. That is the only way we can make steps and to make sure that each one of us knows the sign language. Yeah.
Okay, and now that we're talking about training and more people to be given the ability to interpret, at least for those that are living with hearing impairment, let's go into the education sector.
Yeah.
We have children that are in schools and are deaf. Now, we have special schools for that, but also these same children have to go through the institutions of higher learning and after that go into work. What is the stopgap measure so that it does not stop just at the institutions of learning that are specially put aside for them, but the same services follow them through the institution?
Okay, one, the stop measures which we have put in place, we work closely with the TSC. And some of these special schools, they have trained teachers who are interpreters. In fact, when you visit some of these schools, we have special units for deaf students who are trained by teachers who are qualified to train those students. But we are saying this is not enough because we are looking at higher learning also.
Yes.
We have lecturers who are deaf. I know I have my friend here who is at Nairobi University. He's called Professor Ndurumo. He's a deaf lecturer, and he has been a lecturer for so long. But we are saying that each and every institution, because now this is officially, sign language is officially, and it was passed by an act of parliament. What are we saying? We need more and more interpreters, even ourselves, at our own houses. And that is why you see deaf people marry deaf people. Because they see that is the only way, the easier way to interact. Yeah. So as a council, we are taking steps. We are going to be partnering with other agencies just to make sure that we have more and more interpreters in our institutions.
Okay, so, and you touched something in as far as the people living with the disabilities in this country. We're talking about 2.5 million, is what you said?
Okay.
Is this according to your database or according to the Kenya National Bureau of Statistics?
Persons with disability in Kenya, we are about 6.5 million.
Oh, wow.
We are talking about, I was talking about the deaf people in this country. Only.
Wow.
Yeah.
Okay.
And I will give you a picture. Let me give you a story. Last week, but one, I had a meeting with Governor Jackson Mandago in Uasin Gishu. And he told me what we require is an assessment center for some of persons with disability. Yes. Because out of 3,000 students and children in Uasin Gishu County who were assessed as deaf, 2,800 could hear using assistive devices. So some of these things we need to make sure that they are implemented to the letter and make sure that rights assessment are done to these people so that if they need any assistive devices so that they can hear, they can be given the right assistive.
So clearly this is something that needs to trickle down to other counties because we have those special needs across the country.
Yeah.
So what are you doing to engage the county, the Council of Governors, to help you walk this path?
One, let me say this, Gladys, because I didn't tell you the core mandate of the National Council. The National Council for Persons with Disability was established by an act of parliament, Disability Act number 14/2003. And the core mandate of the National Council is to promote and advocate the right of persons with disability. Another, core mandate is to create awareness for persons with disability, issue assistive devices, also issue adjustment orders to contractors and developers. Another thing is to coordinate with the national government during census so that the government can get the right statistic in order of planning. So, as the National Council for Persons with Disability, under my leadership, I have embarked on one key major issue, partnering with all the 47 counties to make sure, in terms of education, in terms of issuing mobility devices, in terms of issuing adjustment orders. Governor Anyang agreed to me. We had a meeting, and he agreed, and he issued an order that all buildings which will be brought up in Kisumu County, they must have a conducive access to persons with disability. Look at the governors around the country. All the offices of the governors, they are not accessible. They are not accessible. I will tell you for free, because I have visited even our own governor here, Governor Mike Sonko. His office is not accessible for persons with disability.
Speaking of which, you were in Homa Bay, was it, just this month, where and you were captured being carried up the stairs, meaning we do not have ramps in these public institutions. But this is just an example of many other places that those living with disabilities cannot access. So what ideally should be there, apart from ramps? What else do you expect to be put in place to assist those living with disabilities?
Let me say this, Gladys. I usually say that disabilities are barriers created by other human beings just to hinder other human beings doing their own day-to-day business. And this is right, because look, when you build like this building, the Nation Center, and you don't put ramps, you don't put stairs or a lift, even you as an able body, you cannot climb to the third floor, fourth floor. So those are barriers created by other human beings. And some of these buildings, like the one in Homa Bay, the county commissioner headquarters, it's not accessible. I was told that that building was built back in 60s. So it need to be adjusted to accommodate persons with disability, because some of these persons with disability need services from their own county commissioner and their own governors.
And speaking of which, you actually said, and I quote, that the inaccessibility of government offices was tantamount to denying citizens the services, right? Okay, so you say this is something that should be done, but how much, I don't know, reception are you getting from the counties especially?
It's positive. I can say it's positive, because Governor Anyang promised me within 3 months he's going to vacate that office, because that is not the county government office. It's a national government office from the Ministry of Interior. Governor Mandago, he has constructed an office for the county government of Uasin Gishu. So they are very positive. And I usually say, we can say this is it's not, basically I don't say it's ignorance, but we need disability mainstream to our people. We need to mainstream our people on issues of disability. Okay,
now we just conducted the 2019 population census survey, and you just touched on the fact that it was important to understand how many people living with disabilities are in the country right now. Those results, we are still awaiting on them. But I remember even when I was going through the census, I was being counted, there was a question about, is there a family member who has special needs? But that seemed to be the only question within the survey. Is there something you expected that the Kenya National Bureau of Statistics to include in this survey to give you a better understanding of the needs out there?
One, let me say this. Last year we had a disability summit, which was co-hosted by the Kenya government and UK government. And that is when we adopted the Washington group of questions. And in our constitution is very clear, you are not supposed to address persons with disability in a demeaning manner. So what we adopted, it was just in a well manner, just to ask, do you have any challenges? Because I believe even you have a challenge, because you are using your glasses. And also glasses are mobility devices. Because when you remove those glasses, I believe you cannot function properly. So this was a question designed in a manner that will not demean a person with disability.
So that question I should have said yes, because I respect.
Yeah.
Okay.
You're one of us.
All right.
And we usually say disability is a club
Yeah.
that anyone can join at any given time. And this is a club which people join day and night. Look at our accidents. Look at the terrorism which happened. We are only told by the media houses and government how many people have died. How about who have been maimed? Yeah? We are not told the number. And I believe that is the big number. The people who have gone injured and have become disabled. And these people join the club and they are registered by the National Council. So the number is overwhelming. Yeah.
And speaking about the numbers, we are waiting on the results of the survey. When those numbers come out, how does it help the council to cater for the needs of those living with disabilities?
Let me say this. As a council, we are understaffed. We only have 107 staff across the country. And we have distributed each one officer per county. And look at the geographical area of some of this county. They are so big. So for us as the council, this survey will help the council in order of planning and also to negotiate with the government in the budgeting making. Because what the government usually give us, and we get 100% from our national government. We don't get money anywhere. What we get is for the population of 1.3. And I'm telling you, we are about 6 million.
Yes.
So that is why last week, but one, you aired a story of a student crawling to school.
Yes, Gilbert Oteng.
Yeah, let me tell you, as a council, we get a request of 12,000 mobility devices annually. And what we budget for is only 3,000.
As a country?
Yeah, as a country, we budget for 3,000 according to the budget which we have. 3,000 mobility devices. This cut across the hearing impairment devices, the wheelchairs, the crutches, and everything. So we are planning also to make a massive partnering with private sector and government institutions so that they can donate a mobility devices to our people. In that county, we have a representative, we have our DSO. And that Gilbert, that student, already the council had already given him a wheelchair, but that was a wrong specification wheelchair. And this is why I'm saying we need an accessibility center. First, you assess a person and give him the right specification of a wheelchair or a mobility device. Because we gave him a wheelchair which he can wheel. But we didn't consider that this person needed a tricycle so that he can go according to the terrain of that area.
Okay, and I mean, county governments were brought to devolve the services to the counties, to bring the services closer to the mashinani. So Gilbert is just an example of many other needs out there. So how are you tapping into the county governments to at least also chime in money-wise to help you cater for their people within their counties?
Thank you so much. We are preparing a partnership with the Council of Governors. And we are saying as a National Council for Persons, if we are giving a budget of 10 million for a specific county, the county government must be ready to double the money in order to cater the needs, all the needs. We are not talking about the mobility devices. We are talking about the bursary, the education assistant, which is there for persons with disability, because these people need education. And persons with disability are so bright, let me tell you. So you can see, even when you employ a person with disability, compare with other able bodies. So, one, I agreed, I have met with 3 governors, and totally we have agreed that if the council will give the county a sum of, a budget of, an example of 5 million, the county is ready to double the money into 15 million. So that we can plan for that specific county and issues and take the data. The most important thing is about the data. How many people need wheelchairs? How many people need mobility devices? How many students have applied for bursaries in that specific counties? How many groups of persons with disability do we have in a certain county which need entrepreneur, business funding?
Yes.
As a council, we give grants to groups of 100,000 just to cater for their own business. And I was out there and I had testimonies, even videos, of people confessing what the council has done. People confessing that they were contributing 10 shillings per month. Right now, they have bought cows, they have tent to rent, and in their bank account, I witnessed a copy of a balance of 70,000. So those are testimonies which we need, that the government is working toward its people. Yeah, but the need is so huge. We need to come all together with the county government so that we can at least minimize this need.
You said that you have one representative in every county. So you say, and you've mentioned some of the benefits that those living with disabilities are getting from the council. But is there sensitization that is done so that those living with disabilities even know there is leeway for such services?
Yeah, we do this as a national council. We partner, and I said under my leadership, I will work with DPOs. These DPOs, we work with them. We empower this DPO with a grant of 100,000 shillings just to make a massive awareness and also to visit and to make sure that issues and the right of persons with disability are advocated at a county level. So when we are working, and this is very clear in our act, that the National Council for Persons with Disability will work with disability DPOs to advocate and to make sure that awareness is cut across the country. Yeah.
Okay, and speaking about working with the counties, just the other day, I believe it's in today's Daily Nation, where there is an MCA in Nakuru County that came out to say he's pushing for more facilities for those living with autism within that region to be upped, you know, to increase their facilities that they need to go to school, to even go about their businesses in life. Autism is also a form of disability, right from education through to schools. What are you doing to probably cater for some of those specific needs that are caused by certain neurological impairments?
Let me say this. Under United Nations Convention on the Right of Persons with Disability, we have 149 forms of disabilities, and autism is one of them. And I'll take this opportunity first to thank His Excellency the President, because he has agreed to give a kitty to Autism Society of Kenya, 100 million shillings to cater for some of those kids. Some of those children with autism, they have special needs,
yes,
which need to be catered each and every, not even minute, second, to these children. So the government has allocated 100 million, which is equivalent to what the government gave to persons with albinism. Some persons with albinism, the government give an allocation. This is the 7th year, the 8th year. The government is giving out 100 million to albinism, which is managed by the National Council, for sunscreen lotion, gears, protective, we call them protective gears. Another thing is about awareness, creating awareness. You remember when the story of persons with albinism, they were being kidnapped and rituals were done. So the government was so concerned, and that is what the government decided from Parliament. And I would like also to say that would move for persons with albinism, because now, right now, those stories, you can't hear about those stories. They are minimal. And the council is facilitating 358 persons with albinism right now. We have allocated that fund because that was a specific vote which came from Parliament. We cannot touch. That is for persons with albinism. So it will add up also for the autism group. So as a council, we are saying the government has, as a government, we have moved in the right direction. And as a country also, we need to mainstream some of our people, because I usually don't say it's ignorance, but lack of, you don't know, awareness. That is where we want to keep this across, awareness, because you can see somebody is pushing you at the lift, you want to enter and you're using a wheelchair, and he can walk, he can climb the second floor. So what can we do? We need to mainstream some of these people.
And somebody is actually asking, now that you touched on the monies put aside for sunscreen and other protective gear for those living with albinism, there's a condition called vitiligo that's very similar to albinism. It's just that now you have patches of that. Is this group of people also catered within that budget?
Yeah, they are catered under the albinism. And we usually issue them with sunscreen lotion because they also need that sunscreen lotion.
Okay.
Yeah.
Taking you
It's
back.
a form of disability also.
Yes, it is. Not every person can afford these private institutions, which takes us back to our public institutions. What are the structures put in place to cater for such students or people living with autism to ensure that they also get the basic right, which is education?
Under my leadership, we have started requesting and having meetings with our members of parliament. And I will give you a good example. We have Mheshimiwa Theuri of Advocacy West. He has built a full block of autism center. He has valued everything. And in fact, we are going to open that facility for our student. So we need people who are positive toward to gear the issues of disability and more so about autism.
Yeah.
Because these are special group.
Yes.
And they need education. And they are very clever, let me tell you, and very smart, some of these students.
Yeah.
So what we are saying, we are calling upon our leaders. Create time in your CDF. Just put a block there. Because in your area we have those students, we have those cases.
Yeah.
Let the National Council partner with you and give you the right specification and partner with you so that we can make things easier for this group. Yeah.
And even as you're partnering and helping out, and clearly it comes across that there's a lot of sensitization that needs to be done, then isn't it not prudent that we probably put this as part of our curriculum to start with, so that every child is sensitized to the fact that there are people living with disabilities and we need to cater for them in such and such a way, and sign language can be taught right from the start?
That is a good move. And that is what we are gearing to with the Minister of Education. Because now, right now, we are talking about CBC.
Yes.
Competent-based curriculum.
Yes.
Our teachers, our special school teachers have been trained. And we want to bring in also that some of these special cases and special education cater all aspects of disability. So when And that, if you remember the government, the president announced that now we shall be having integrated school, because we don't need to have a special school for a student with disability to learn with persons with disability. What about future in life?
Yes.
They need to integrate when they are still young. So when you become big and older, you interact with everyone, because now it's a normal life.
Yeah.
So that is very important even for us. And we are trying to push for that, so that this student can see they are equal like other students. Yeah, they don't have much challenges because they'll overcome them as times come by.
And talking about opportunities, integration into society, they grow up and they're part and parcel of the general community. What are you doing to ensure that in the workplaces, in the offices that they go to get services, that these group is catered for and they are able to be given equal opportunity at all levels?
Let me tell you, Gladys, under our constitution, it talks about the progressive job opportunity for persons with disabilities. But I'll tell you, and I will keep on repeating again and again, this is about perception, about attitude toward persons with disabilities. Why am I saying this? Look, when you are advertising for a job, you say person with disability are highly encouraged to apply. But when a person with disability apply for this job and he happened to be shortlisted and called for an interview, when he just came in, or he or she come in, you look at the wheelchair or his disability. You don't look at a person. You need to look at the person himself. Don't look upon his disability, because some of these people are very sharp, they are competent, and they can be good. They are good workers. That I can tell you for free. Some of these people, they are very good. So when we are saying this, and there is a policy also, government came with it, about business, which persons with disability are supposed to be doing with the government, the 30% AGBO, access to government opportunities. And you can hear people saying that persons with disability, they are not applying for these jobs. But let me ask you, one, this person is challenged. You keep on telling him, go, come back. You don't have job, go, come back. For how many times? He has hired a taxi. And he doesn't have money. He or she doesn't have money to do so. So, some of these things, and I have said, it's barriers which are created by other people, just to make sure that these people, they don't access what the government has given to them. Right now, under the 30%, company owned by women, they are around 800,000. Owned by youth, they're about 200,000. Owned by persons with disability, we're around 5,000. You see the margin. Where is the quality? And as a person with disability, we say we don't want to leave anyone behind. Leaving no one behind. We need an inclusive society. Yeah.
Okay, and even as we think about inclusivity, and you've got to think beyond, again, your vision is a barrier-free society for persons with disabilities. There is the need for, and a question for, a person living with disabilities is already disadvantaged in one way or another. Then there are other societal vices that they have to live with. We're talking about sexual violence, gender-based violence, and such like things. What does the council do to assist those that are affected by such?
Okay, we have a Department of Legal, which we work closely with the CAJ. Commission of Administrative Justice, to make sure that recently we had a lot of cases of rape. A person with disability, maybe she's mental or deaf, she has been raped, and she's a child. So we have picked up some of these matters, and we are going to bring these people on books, because the law must take its course. And as a council, we are saying this, and this is a warning for those people who think they can misuse persons with disability. We're talking about also those people who bring people from outside this country just to beg for money, because those people you are seeing on the streets are not Kenyans. These are people from other countries, and they are brought by people just to make money on their behalf. One, this is a human right violation, and we as a council, we shall not accept. We shall make sure that dignity for persons with disability, not only in Kenya, around the world, is taken care of. Because just think about that person. Since early in the morning at 5, she's there, borrowing money. She doesn't go to the toilet. She doesn't have any facility there. Until evening, when somebody will come and pick him or her with all the money to go and take that money. That is not right. That is a human violation in our country, and we cannot accept that one. We are picking that matters of law. We are going to make sure that those people who take advantage of persons with disability in terms of raping them, in terms of violating their rights, are brought to book, and justice will take its course.
Okay. Now, you just got appointed to chair the board of the National Council of People with Disabilities, and you have this term for 3 years. What are your plans?
Thank you. One, unity. I'm calling upon unity of persons with disability, because when we have unity, some of these challenges we can be able to push when we are one team. Number two is about, I want to make sure that registration of persons with disability is accessible than ever. Because right now, we are subjecting our people to a very, very tedious process. And I'll say this, because when you are subjecting a person from Mombasa or Turkana to come to Nairobi to receive his or her medical report, what are you telling that person? Do we have those doctors in the counties? We have doctors in the counties. Do we have our officers in the counties? Yes. Let that person receive his medical report back in his own county. Let that person receive his registration card in that county. Yesterday I had a meeting with the Commissioner of KRA, Domestic Task, and we are discussing about the exemption part of it, because we are having a lot of challenges. People are pretending to be disabled for a mere fact to get that exemption. So we are going to have that discussion. The right people be given the exemption they deserve, so that they cannot pay taxes. But we cannot accommodate everybody People are pretending that they are disabled. They have gone to those hospitals, acquire that medical report, come back to us. Some of us, some of them, we are chasing them away because they are not disabled. So that is one of my major issue, which I will deal with it. Another thing is to make sure that schools made for persons with disabilities, we partner with the Ministry of Education, and to make sure that each and every school, first we shall do a survey and come out with a survey that how many schools do we have in this country, and each and every school must set aside a special unit for some of these special students, just to make sure that our students have a conducive environment for learning. Those three are my major, because 3 years is just a short period.
Yes.
And I must be focused. I don't want to mention about 10 major issues, but I have mentioned about registration, that is one. Tax exemption, that is two. Medical report, 3, and education. And another one which I have already done, I had a meeting with the Cabinet Secretary, National Treasury, who had up to be our own CS at the Ministry of Labour and Social Protection. And he agreed that this time around, the cash transfer, we're putting on budget twice. We only target 47,000. Now we shall be targeting, and it will be agreed because I will lobby even to our National Assembly members of Parliament. We need 94,000 so that we can cater. And these, I'd like to say this, Gladys. Since 2013, when His Excellency, the President, came into power, the Council was targeting 10,000 cash transfer. Right now, we are targeting 47. The government again has agreed to double the number into 94. So we are making move.
Okay.
Yeah, we're moving, and we are happy.
And how will the council ensure that that money gets to the right people?
Yeah, thank you. The council, the government has come with a good model of payment. We have about 4 banks, and each and every beneficiary has opened an account with that bank. So this is a good measure, because 6 months, if you don't pick your money, the government presumes that either you're dead or you're not there. So that money will be in your account, and no one else can access your account because it's a biometric. Yeah.
Okay, and even as we bring this conversation to a close, they say disability is not inability, and this was literally showcased the other day when Kenya actually flew our flag really high, when we marched top at the Africa Deaf Athletics Championships held at the Moi International Sports Center, Kasarani, 55 gold medals. I mean, this is such an admirable move, and I think at that point you can put across to Kenyans, what are the things you'd like them to keep in mind as they deal with those living with disability?
Thank you so much. I'd like to tell Kenyans that we are your brothers and sisters, and we are more capable, and I'll say this for free, we are more capable than even able bodies. Look, when you give an opportunity to persons with disability at your office, that person does not have time to go up and down. He'll sit there. These people are very competent. Another thing, look, ask yourself when you're building your own house or your own building, and I have said this is a club, anyone can join.
Yes.
So you want next time when a member of your family or your friend visit your house, he or she cannot access your house. So think around that. Accommodate everyone. Accommodate persons with disability. Persons with disability are friendly people, and they are people who you can trust. As persons with disability, also our leaders and governors, we want to request you, and I know we are coming to partner with the county government. Look at the issues of persons with disability. When these people are doing their own business, they need to be allocated their stalls where they can do their business without being chased, without being harassed by the county askaris. Because these are people who are looking for their own means of life. You need to give them a chance. They are not borrowing. They are genuine people. They are your voter as a governor. So then you turn around to become a wide person to your own children. So this is an appeal I'm putting to all the governors and the Council of Governors. Look at persons with disability who are doing business in the counties, and also our teachers, our government. Look at persons with disability as people of Kenya.
Okay, all right. Peter Mashiri, the board chairman, National Council for Persons with Disabilities. Thank you so much for your time and elaborating the challenges those living with disabilities have, and of course the strides that the council has made. Well, remember, do unto others as you'd like them to do unto you. That has been our conversation this morning. When we come back after the short break, we cross over to Nakuru County, to be specific, the Rift Valley Sports Club, where the career fair that is being hosted by My Network, a subsidiary of the Nation Media Group, will be taking place. Dan Wangi is seated with a panel, and they will be walking you through that conversation. Stay with us.